If you've undergone a septoplasty and your nose is still stuffy, this video is for you. I'll reveal what steps you and your surgeon can take to fix your breathing problem once and for all. One of the most frustrating things that patients experience is to undergo any surgery without seeing any benefits. I saw this happening frequently with patients coming to see me after they underwent a septoplasty operation by someone else but didn't notice any improvement in their ability to breathe. Within the first few minutes of the examination, I can tell the patients what the problem is. It's a simple two-step maneuver which I'll describe later in this video. You can do this yourself at home as well. Hi, I'm Dr. Stephen Park, an ENT surgeon and sleep medicine doctor with a passion to help you breathe better and sleep better so that you can enjoy living life again. If you want to know why your septoplasty didn't work to cure your stuffy nose, it's important to understand why you have a deviated nasal septum. The word septum means dividing wall, and you have many other septums in your body. Your nasal septum is the midline plate of cartilage and bone that separates the right and left side of your nose. The front part is what's called the quadrangular cartilage, and this is what you can feel when you wiggle your nose. Towards the back at the top is a perpendicular plate of the ethmoids, which is a bony plate. Along the bottom towards the back is a triangular piece of bone called the vomer. Now I'm going to describe why people have deviated nasal septums, something you won't see or hear about anywhere else. As you'll see, it makes total sense. There are a number of myths and misconceptions about what causes a deviated or crooked nasal septum. Most doctors learn that it's from trauma to the nose during birth, coming out of the birth canal, but we see people with deviated septums all the time who are born by C-section. Plus, in general, you don't see deviated septums until you're a teenager or adult. You can also believe that any kind of physical trauma can cause a deviated septum, such as being punched in the face, but that's been shown to cause a buckling of the septum in a vertical direction like this. Most deviated septums curve horizontally like this. What you actually see is the most severe part of the deviation happens where the cartilage and the vomer meet on this line. And this explains what I normally see during septoplasty surgery. In the front, the top half is cartilage and bone is on the bottom. In the back, it's all bone. So what causes this to happen if there's no trauma? In my book, Sleep Interrupted, I read about how modern humans, due to a change in our eating habits and infant feeding methods, jaws are shrinking and our teeth are getting much more crowded. This is why younger people these days have more triangular lower faces. If you look at some of the movie stars before the 1950s, you see that they had very wide faces compared to more modern faces. I talk about all the different reasons in my video, Why Face is Shrinking, which I'll link to below in the description box. This is why it's a given that almost everyone would need their wisdom teeth taken out, whereas over 100 years ago, this was rare. And now it's a given that you'll need braces. So how does this lead to a crooked septum? During early development, the upper molar should widen and the roof of the mouth, the hard palate, should drop like this. With modern faces, this isn't happening as much, so you're left with more narrow jaws and a higher arch palate inside. Inside the nose, the nasal septum sits on the middle of the hard palate, called the maxilla. If the hard palate doesn't drop, then as the septum grows, it just buckles to one side like this. And where it buckles is the junction, right here, along the upper border of the vomer, where it meets the cartilage toward the front and the ethmoid bone in the back. Now that you know why you have a deviated septum, let's talk about the septoplasty procedure. A septoplasty operation is one of the most commonly performed procedures by ENT surgeons all over the world. It's also one of the most misunderstood procedures by patients and the lay public alike. First of all, a septoplasty is not the same thing as a rhinoplasty or a nose job. The nasal septum is a midline wall made of cartilage and bone that divides the middle half of your nasal cavity. It goes all the way to about half the distance of your head, from about here to here. So the term septoplasty means modifying or changing the septum. This can be done for breathing problems because it's crooked, but it can also be needed as part of a cosmetic rhinoplasty in addition to the nasal bones. And just because you have a deviated or crooked nasal septum doesn't mean you need surgery. Only if you can't breathe and you've tried every conservative option should you think about surgery. Now I'll go over 7 of the most common reasons why your septoplasty operation didn't work to help you breathe better. Number 1, the septum wasn't addressed properly. There are lots of technical reasons, but you have what are called spurs on top of the maxillary crest, a high dorsal area, which can touch the nasal nostrils on one side. Also, way in the back along the line of the vomer higher up, you can also have a large spur that juts to one side as well. The second reason is that the turbinates weren't addressed at all or addressed too conservatively. Now, I mentioned the issue of empty nose syndrome in another video, and I think because of the fear of causing empty nose syndrome, many ENT surgeons have resorted to performing much more conservative procedures, but sometimes it's not aggressive enough. Number 3, flimsy nostrils were not addressed, and this can sometimes be made worse with better breathing. because the better you breathe in, the more your nostrils can cave in, similar to when you suck through a flimsy straw and the tip collapses. Number 4, oftentimes you'll have 2 or all 3 of the above. One important point to make here: the reason why these 2 other areas are involved is because of jaw underdevelopment that I mentioned earlier. If the upper molars don't widen, the side walls of your nasal cavity is too narrow, so the turbinates will be placed more towards the middle, closer to the crooked septum on both sides. Also, the angle between the nasal septum and nostrils will be more narrow, making it more susceptible to collapse when you breathe in. This is why a palatal expansion procedure can also help with your nasal congestion. I talk about this procedure in much more detail and how to get rid of your stuffy nose for good, ENT doctor approved. So here's the maneuver I mentioned that can tell you what's still causing your stuffy nose after septoplasty. Even if you never had surgery, this works just as well. Lift up your nostrils from the inside using Q-tips, and also spray some decongestant like Afrin or oxymetazoline, which is the generic name. Or you can use breathe right strips along with the Afrin just before bedtime to see how it affects your sleep. If the decongestant alone works to help you breathe better, then you need more work done inside your nose. If the spray makes no difference and lifting up your nostrils makes a huge difference, then you need to take care of your flimsy nostrils, which I detail what the options are in the video link above. And here are some other medical reasons why your nose is still stuffy after septoplasty or any other kind of nasal surgery. Number 5, you can have chronic medical conditions such as allergies, hyperthyroidism or low thyroid levels, non-allergic rhinitis, and even too much estrogen, which is found in many medications such as birth control pills, BPAs and phthalates and plastics and air fresheners, glyphosate in most of our crops, and countless other areas. Number 6 is acid reflux. Your stomach juices can literally come up into your nose and sinuses and ears, and even down into your lungs. It's not just acid, but also bile, digestive enzymes, and even bacteria. Even if you take acid-reducing medications, it still comes up as less acidic juices, but the enzyme pepsin can be very irritating. Pepsin has been found in the nose, ear, sinus, and lung infection fluid. Number 7 is gluten or dairy sensitivity. I won't get too much into these 2 food items, but think of it like another type of allergy that affects your nose as well as your gut. Remember the saying, when in doubt, leave it out. It's important to remember that if you still have a stuffy nose after surgery, it's usually not only one of the above, but a combination of multiple factors. So you and your doctor have to do some detective work and to check off each of the above items. The good news is that for most patients who came to see me with a stuffy nose after undergoing surgery elsewhere, we can usually get them to breathe much better. So don't give up. For a much more detailed explanation about why your nose is stuffy and what you can do to fix it once and for all, watch this video, How to Get Rid of Your Stuffy Nose for Good, ENT Doctor Approved.